Hi everyone, this is Janet Hill at the Rock Island County Health Department. We appreciate you joining us on such short notice. Today we have Nita Ludwig, the administrator of the health department here, and Dr. Cheryl True, who is our medical director. We're going to start off with our usual case count, but then we have some additional information to pass along. Nita, go ahead and start, please.
Okay, good afternoon. We do have 56, that's 56 new cases of COVID-19 today in Rock Island County. We have 10 of those that are associated with an outbreak at East Moline Correctional Center, and our total is now 2,378 cases. We are unfortunately reporting one additional death from COVID-19 in Rock Island County, and that was a man in his 60s who had been hospitalized. And now our death total is 68 for Rock Island County, and our deepest sympathies go out to this man's family and friends at this time. 13 other people are hospitalized currently in Rock Island County. And Brooke, if you wouldn't mind pulling up the map at this time. For several weeks, we've been bracing for Rock Island County to move into the state's warning status. Frankly, we were surprised that it hadn't happened yet. The Quad Cities has been a COVID-19 hotspot in Illinois for many months, and Iowa's positivity rate is among the worst. Today it happened for Rock Island County. We have officially been warned. Our positivity rate is 8.1% as of August 28th, the reporting period last week, which is the time frame when the warning is triggered. Positivity is just one of 8 different indicators that are being used. To be in the warning status, a county needs to have at least 2 of the 8 turn to the orange. We have the warning level of positivity rate, the high number of our cases, the number of deaths reported in that week, and the total number of tests performed. Being in a warning status is just that, a warning. We are heading in the wrong direction and have been all summer. Residents all across the Quad Cities should be wearing a mask, watching their distance, and washing their hands frequently. We know the rules are different in Iowa, but your efforts should be the same everywhere you go. Illinois is divided into 11 regions. We are in Region 2 that stretches from Rock Island County over to the counties just west of Chicago Metro, down to Bloomington Normal, over to the Mississippi River, and back to us. The governor's Restore Illinois plan allows for those 11 regions to move backward into tiers if necessary. 2 regions already have, which was near St. Louis and Will County and Kankakee counties in the South Chicago suburban area. We are dangerously close to the status here. It could happen next week. 6 of our region's 20 counties are in the warning status, including the more populous counties of McLean, Rock Island. Other counties in the region include Henry, Stark, Bureau, and Warren that are all in the warning status as well. If we don't heed this warning, our region could see these mitigations or restrictions coming in the next week, which have been all bars and restaurants would have to close at 11 p.m. There would be no indoor dining or bar service, no ordering, seating, or congregating at a bar, no standing or congregating indoors or outdoors while waiting for a table or exiting establishments, and no dancing or standing indoors. We know this is the last thing anyone wanted to hear, especially before the holiday weekend, Labor Day. And as much as we want to ignore COVID-19, we can't. No one is saying you can't have fun this weekend, but please remember the warning you are getting today. Have your party, but just have it small and outside and physically distanced. Require that everyone wear a mask, watch their distance, and wash their hands often. Find ways to have fun, but please do it with COVID-19 in mind. Spend time outdoors. The virus doesn't spread as easily outside. And I'll say it again, wear your mask, keep 6 feet of distance between you and others, and wash your hands. And
Thank you,
Janet, if
Nita.
you want
Oh, I'm sorry, I didn't mean to step over you there.
to, that's okay.
Thank you. Let's go to Dr. True so she can talk to us a little bit more about the medical implications of a COVID-19 diagnosis. Dr. True?
Hi, good afternoon. Thank you for having me on today. You know, I reflect upon the report that Nita just gave, and I think that we often see COVID reduced to numbers of tests, numbers of cases, numbers of deaths, the ages of those individuals. And numbers don't always resonate with people in their everyday lives. They can seem kind of abstract, like talking about budgets with millions and trillions and billions of dollars. We just let some of that information start to slip by and blur. But the numbers are really important. They help us analyze what's happening in our world, our country, our state, and at this point, more importantly, our county. But those impacted by COVID personally, or by having a close family or friend that may be affected, maybe look at those numbers differently. Maybe they're grateful that they fell into that category of those who only had a mild illness, or maybe they recall how they felt when their temp spiked to 104, how that cough just racked their body, how their muscles hurt with every movement they made. How weeks later, maybe it was still hard to walk across the room without feeling short of breath. Maybe they're shocked by a family or friend that was in the hospital that they visited with virtually. And at the time of discharge, maybe weeks later, they couldn't believe how much that person had changed or how weak they had become. Previously independent people that required assistance to do their daily activities of living, couldn't get back to work or school for weeks after they became ill initially. We realize that many people yet don't have personal experiences like those with COVID, and the pandemic does seem sort of distant to their own lives. But with the number of cases being seen today, we know that this is becoming less common, and more people know someone who's been affected or have been affected themselves. COVID is now recognized as more than just a respiratory disease, which early on, that's how it was initially described. We know it's a multi-system disease. It affects more than just our lungs. We see symptoms not only of cough or shortness of breath, but fatigue, loss of smell or taste, nausea, vomiting, diarrhea, and skin rashes. We also see effects on the heart and on the nervous system and within our blood vessels. We see our own immune systems contributing to the complications too. Many of you have probably seen reports of young adults with strokes, athletes in the prime of their condition being affected with a heart complication, or even healthy people with memory or thinking problems after having COVID. Children have been diagnosed with a multi-system disease. And well-known people have shared their stories, people like athletes, actors, healthcare professionals, and politicians. And while scientists are still in the early stages of understanding these features of the disease, we have yet to know what the long-term effects of this virus are going to be. So we do know that some people have higher risk of severe disease. And I think heading into the holiday weekend, this is something for us to keep in mind. We know that age, older age, is obviously one of the biggest risk factors, but other things are common conditions that we see every day. Type 2 diabetes, heart disease, sickle cell disease, cancer, COPD or lung disease, chronic kidney disease, immunocompromised states, those with weakened immune systems, and obesity, and others that might be at higher risk of stroke but aren't in that known high-risk category but a potential include those with moderate to severe asthma, stroke, high blood pressure, liver disease, pregnancy, and other lung diseases among them. So these are risks that we see associated in just our general population, and we know that there are societal factors as well. And children, who we think of as maybe being mildly affected, if they have complex medical conditions, they are also at higher risk for severe disease. Now, we're really lucky. We have a society in which people with significant health conditions can lead pretty normal, active lives. They're able to go to work, they can go to school, they shop, they participate in recreational activities. And they may be folks that you see taking more precautions during this pandemic. But when I hear somebody say, protect the vulnerable, I hear, protect my family, protect my friends, protect my neighbors, protect my coworkers. Lives in our community are intertwined far beyond what we see in our personal view. So as we head into this holiday weekend, we take part in back to school activities. We foresee some of that cooler weather coming that's starting to push people indoors. I just urge you to consider that the people around us have these health conditions, whether we're aware of them or not. And note that many people have more than one of these conditions. This could put them at risk for more significant infection consequences, and illnesses, even mild, take us out of commission. We can't do our jobs. We can't have the people pick up trash. We can't have the people teach our children, wait on customers, fill orders when they're ill. And so this really does impact us all. Our community is experiencing both clusters of cases, those occurring within certain groups that are tied together in some way, and community cases, those acquired during our day-to-day activities. And of course, with clusters, many of those individuals are active in our community and not isolated behind closed doors. Consider that our workforce is made up of all ages of adults, and that even elderly and long-term care have caregivers from the community. We have recently seen many more cases among our young adults, which appear to be acquired through social settings, maybe larger groups, not wearing facial coverings. And these young people don't exist in isolation. They interact with those around them, including their children, their coworkers, parents, and grandparents, and their community members when they're out in public. We are all connected in many ways, and each of us can take that personal responsibility to help protect our community. This helps us keep our businesses open, our kids in school, our vulnerable populations safe, and our healthcare systems from being overwhelmed. So this holiday weekend, as Nita said, think about your plans. Are you able to maintain that distance? Can you move away from others, be outside? Can you wash your hands frequently? Wear your facial covering. This pandemic isn't over, and we each have a personal role to play in controlling the spread of the disease. The virus really doesn't have control over where it travels. That's up to us. So let's help stop the spread. So be safe this holiday weekend and get outside. Enjoy your time.
Thank you, Dr. True. We appreciate your medical insight there. Let's go to the questions. This is from WVIK. Since this information is based on data from August 28th and this week is almost over, is there really any question that Rock Island County and perhaps Region 2 will continue to be in warning next week? Nita, would you like to address that?
Sure. As we have been reporting this week, the numbers have not gone down. I just reported 56 new cases today, and that's already over the target for the whole week in just one day. So I fully expect that Rock Island County will continue to be in the warning level through that next reporting period. The question is really the rest of the region. Will there be enough counties within the rest of the region to trigger us all into those mitigation steps that I talked about earlier? And we won't know that until at least next week sometime, probably Thursday or Friday morning.
Okay, thank you. The state reported 5,368 new coronavirus cases today and said that the spike is due to a lag in reporting. Has the sudden infusion of those cases into the total been a factor in Rock Island County's elevated into warning status? Any idea, Anita?
Sure. I don't believe so because we've been monitoring our own numbers since the pandemic began. And just like we said basically at the beginning of this, it was kind of surprising to us that that we just now became in the warning level. We had thought for the last few weeks that we would probably be in the warning level. So I don't think that really had an impact on our status locally here.
Okay, and just remember that the warning status is just that. I mean, it is a warning, and if enough counties in our region go into warning status, that's when those mitigation efforts that Nita detailed are.
Correct.
Another question, have there been any outbreaks connected to schools going back in person? And will they be listed on the website like nursing homes?
We have not been told yet if the Illinois Department of Public Health is going to release outbreak information on schools on their website, so I can't really answer that to the point. As you know, all Rock Island County schools are now back in session. Some are virtual, some are hybrid models, and some are in person. We have spoken to many schools over the last couple of weeks, and there have been kids here and there that have had to quarantine or be excused from school. We haven't had any outbreaks to report at this time yet, though, so We've been very fortunate in that respect, but, you know, the virus is still circulating, so you never know when that might pop up. Are you still there, Janet? I think she's muted. So I do see the question about the trend of the total number of tests and how the state measures that, and Rock Island County's numbers and the target. So we do feel like there is not enough testing. I mean, generally, I think that's the case in most parts of the state and the country in general. That is one of the reasons why we have asked for those temporary test sites to come to our county, which helped us test more people. But, you know, we still feel like there is more testing that probably needs to be done. Community Healthcare, who is our partner, we are working with them to assist them to try to ramp up some of the testing that they can do, and they're working very hard with us. They're a great partner, so that there will be more testing available in our area. We have requested the temporary test site to come back again, and when and if it's able to come back into our county, we will definitely put out a press release and let everyone know when that's back in our county.
Thank you. Sorry, I did have myself muted. Looking at data with the other counties, what is your feeling about the region sliding back into mitigation?
Yeah, that's a really tricky one, and I don't have a crystal ball, although I wish I did. But for our county, we have not seen really any improvement for the whole month of July and August. So, you know, we certainly want those numbers to come back down again. That's why we're trying to really push the messages about watch your distance, wash your hands, and cover your face, especially going into this holiday weekend. And we really just want to really implore everyone to not have big parties or giant social gatherings, and really consider what activities you're doing this weekend.
So, you know, you reported, Nita, that there is another or a continuing outbreak at the East Moline Correctional Center. What is the prison doing to help prevent more spread of the virus?
Well, they are testing more frequently, so that is probably why we're seeing some of the increase in the numbers from the East Moline Correctional Center. And probably a lot of those people are asymptomatic or not necessarily ill. And I do know that the Department of Corrections actually takes the lead on the East Moline Correctional Center with the mitigation efforts going on there in close concert with the Illinois Department of Public Health. However, our nurses do talk with the correctional staff every week and just touch base on all their cleaning and disinfecting and strategies they're using, and making sure that they have enough personal protective equipment and that sort of thing.
What is the mask policy for inmates at the prison? Do we know, and how is it enforced?
Yeah, again, you know, that is really in the realm of the Department of Corrections, but the mask mandate is for all of Illinois, for you to be wearing masks whether you're within 6 feet of anyone at any time. So that should be enforced no matter what type of facility it is.
So do the Illinois Department of Corrections statistics lag compared to our totals? It shows 159 total cases at the correctional center. Maybe you can speak to just the general lag between local and state data sometimes.
Sure, yeah, I don't know that specifically, but we do find there is a lag from our reporting, and we're reporting the results as we get them in, either by fax or through our disease surveillance systems. So sometimes they're off a couple of numbers here and there for 2 or 3 days usually. But, you know, it's kind of a rolling number. I will say the Department of Corrections, the testing that they're doing weekly, it seems like a lot of their test results do come on Fridays. So on Fridays, sometimes we have an influx of a bunch of positive test results from the East Moline Correctional Center.
Okay. I believe that's all the questions we have so far. Let's just pause a couple of seconds here and see if anyone else has any questions for either Nita or Dr. True. Nita, any idea what the total number is for long-term care in the county? I believe that's on the state's website.
Yeah, that is on the Illinois Department of Public Health website. It's the same one that Brooke was sharing. It's just under long-term care facility outbreaks.
And there could, like we've talked about before, there could be a little bit of a lag between local numbers and state.
Right. And that is, you're right, 828, they have just updated it, or they will be updating it within the next hour or so with the map. That map just got updated around noontime today, so the other parts of the website should be updated as well.
There's a question about the percentage of ICU beds are available in Rock Island County. How many or what percentage of non-ICU beds are available for COVID patients? Is that something we would know, or something that would be a healthcare delivery question?
Yeah, the health systems would probably have to answer those questions. All we really know is the same information that you get from that Illinois Department of Public Health website, is that the percentage is still within the target, so we are not in a warning level on those.
Okay. All right, well, I think we're going to send you off to your holiday weekend plans, but as Nita said, remember to keep it small, wear your mask, keep it socially distanced, and remember to wash your hands. We wish everyone a good time, and thank you both to Nita and Dr. True for taking the time on a Friday afternoon to do this. Thank you, everyone.
Thank you.
Thank you. Have a good weekend.